Good morning, this is Phil. We just had someone join. Who just joined?
Vicki with Monroe County.
Morning, Vicki.
Marcia Behringer from Fayette County Health Department.
Morning, Marcia.
And Kendra Craig from Fayette County EMA.
Yep. All right, I know folks will begin to trickle in as they are now. Just to let everybody know, we are recording this call, so this will go up to YouTube later this afternoon. So in case anybody missed it, they'll be able to review what's happened. Hopefully everybody got a copy of PDF of the slides. I know we just had someone join. Let me go ahead and capture you while I got a chance. Who just joined?
Heidi Carter with Jersey.
Hey, morning, Heidi.
Morning.
All right, we're going to go ahead and kind of get started for what we got here today. Today will be pretty short. If you've seen the slides, it's a pretty short meeting. We'll probably be done in 20 minutes or so, pending any questions and as folks trickle in. So again, good morning. This is Phil Pugh for our monthly regional teleconference, healthcare in our Hope Healthcare Coalition. So as far as the agenda is concerned, we're going to talk about IDPH's planning percentages for surge and look at all of our Healthcare Coalition deliverables and milestones for 2020. And then we'll just open it up for questions. So when it comes to surge planning, we have some updated information in our scope of work this year that basically cover that surge planning percentage. Right now, as you can see, what's written there, I pulled that directly out of IDPH's document, and it basically says that we need to prepare to surge for 150% of our basic census, our typical census. That's a little bit different than what we'd used in years prior. So probably the initial one that we used, surge the planning factor we used was for 500 per 1 million in population, which put us right around 420 beds. And that's based on just taking all of our counties, and we were right around 780,000 in population at the time, maybe 760 when this first came out, and that put us right around 420. So the population and I'm sorry, I had a phone call come up. We also had, and what's our current planning factor we had was 20% of all licensed beds. So that number still put us right around 405 beds. So those are pretty similar. Haven't done the math right now with regard to 150% of our licensed beds through here, but I believe it's actually going to be somewhere close still to around the 400 and some odd number. So if that's the case, then I think what we have listed as far as our planning factors would be good. Greg, I don't know if you had any other additional information with regard to that surge planning percentage.
I don't have anything to this, but you said licensed bed, which is always much more than typical patient census. So my question is, are you going to go actually on that verbiage, typical patient census?
Yep.
Because like all of the 9 25-bed critical care access hospitals never have anywhere close to 25 beds full. So
exactly. So my goal is to use whatever their typical census is, their average daily census, as I guess we use day to day. Because all those original numbers were around licensed beds, and even the healthcare coalition surge test, when we do that, that planning factor is still 20% of licensed beds as well. So I'm hoping that typical patient census or average daily census number, 150% of that is somewhere close to the 20% of licensed beds. Don't know yet. And I don't know do you already have all those numbers or is it? I know there was a spot. There was a website that I looked at years ago, a couple years ago when I was doing the original planning for it. I have since lost said website that would actually provide me all those numbers.
I think IDPH does one, and I also think I thought I heard Illinois Hospital Association. There's something hospital association. I don't know if it's them. I think they publish an annual one for all the hospitals in Illinois.
Yeah, Phil, this is Kanitha. If you need those numbers, I can get you authorized beds that get submitted to the American Hospital Association.
Oh, that would be awesome. So yeah, we're looking at just for our 11 counties, and the 19 hospitals that we have in our 11 counties. So if I could just shoot you that list, would you be able to send that back?
Yep, I can get that before the end of the week.
Okay, outstanding. Perfect. Much appreciated. Any questions with regard to these numbers that we have listed or concerns? All right. So that is something that we're going to have to adjust, and hopefully if the numbers come out to or, at the numbers that we had or less, then I think that our planning factors will be fine and we won't have to make any major adjustments. All right. Yeah. So next thing we have is our Healthcare Coalition deliverables. And, basically I'm calling this grant milestones. Hopefully I put these in pretty much in chronological order as best as possible. There are a few more that are on here that aren't listed, but are, I'd say, a little more low-hanging fruit. They're not as involved, that don't require a lot of coalition, a ton of coalition involvement. Maybe there's some one-offs that we're just going to manage here. But these are the major ones, and it's still a pretty healthy list if you take a look at it. So I'll just start with the very first one. It's conducting a communications drill with the State Burn Coordinating Center. We will be conducting that, one of those this month. Hopefully we'll get it done. And all of these target dates that I have there where you see NLT, that is no later than. So those are the dates that we have. That's not what IDPH says the no later than date is. Some of those are self-imposed dates that we put on ourselves, so we can actually meet IDPH's dates. So it's going to be kind of difficult to make it a little easier than doing some of these things a little bit later. So we're front loading a lot of the things that we need to get done to make room for our exercise in the spring, and to just give us a little more breathing room, some more time before any of the IDPH deadlines come up. So again, that first one is a communications drill with the State Burn Center. We are going to knock that out this month. Lee's going to be in charge of that. Our Healthcare Coalition Surge Estimator tool, that is something new this year. Matter of fact, maybe 2 weeks ago, I think Katura sent us an email saying, hey, it's out. So we're just kind of, peeling the layers back on that specific tool and what that means to planning and what we need to do to get that done. But the goal is to have it done by September 30th of this year. Our Healthcare Coalition Surge test, we're pushing that up early this year. We talked about that at our previous coalition meeting, and we want to knock that out as soon as possible. So as of right now, we've only got one volunteer hospital that wants to participate, and that's Staunton. So I don't know if Sue, if you jumped on yet, but Sue has raised her hand and said, hey, yeah, we want to participate. But remember, the goal is that we're trying to get that 20% of licensed beds to participate. So we need that many evacuating beds across the region. And I know a lot of times that means, some of our critical access hospitals, yeah, you may feel like you don't have a lot of licensed beds, but it's still a great exercise to go through. Everyone has had some gems come out of that where they said, hey, we never thought about this or we never thought about that, especially when they're working with their EMS counterparts, et cetera. So I think this is something that everyone can benefit from, and I'm hoping to get as much participation as possible. So if you want to knock that out, or if you want to be a part of that, Make sure you can send me an email, send Leah email, send Leanne an email, or you can fill out our Google form that we have out there. We'll send the link out. We've sent that out a couple times, but we can definitely send that out again if you want to sign up for it. So, and it's very low threat, so it's not super heavy when it comes to needs and resources. Just getting your folks in a room and being able to discuss is great. Having some phones would work too. After that, we got a Healthcare Coalition self-assessment tool that we're going to try to knock out. I'll be talking with our executive committee folks and seeing if we can get that done by September 30th. A lot of that's a part of our online. We got our coalition assessment tool, and sometimes those things aren't available early, so sometimes they're available late. So this is an ambitious timeline, but we want to get it done early. Our KIMPAC and MCN, our MCM and SNS training. So we try to do this annually. Normally we've done it in the late winter, January, February timeframes. This year we're going to try to get it knocked out before Halloween. So normally what that consists of, I invite, whether it's Beth Busman or I invite Carla Little, Greg stood in at one point to help provide the training, but we just basically go over our KIMPAC process and what the SNS provides to the community, to the region, and some of their processes. Again, very low threat, but it's highly informative. And it's something that I recommend that when we do host that as an event, you ask some of your pharmacists, some of your hospital administrative leadership, whether it's your CNO or someone like that, maybe one of your nursing director, to attend because they'll get something out of that training. The regional MyTAP, we're going to update that and put that back into SEMP. That's something that's got to go into SEMP. But as of right now, again, I don't think some of those things are updated in SEMP. The MyTAP portion, I think, is accessible and we can go out, but there are a few other things that aren't. And some of those things that aren't set up yet are HVA and CPGs in SEMP. So that's another big milestone we have to do every year. Previous years, we've done that or tried to get it done early spring. This year, we want to get it done before Christmas. We want to definitely have that knocked out before Christmas. And I want to actually host 1 or 2 workshops with this process so we can actually bring in some of our partners that are not just hospitals and see if we can incorporate more of what the problems that they see or whatever vulnerabilities that they have and how that affects us or how that affects the region as a whole, specifically hospitals and our EMS providers. After that, hiring a regional clinical advisor. And right now we do have a position that's out there. We're looking at a 0.25 FTE. So basically that's, 5 days out of a month working on regional planning and liaison between some of our providers around the region. That job is out there and it's available. If you go to the BJC website, and if you are a practicing RN and want to join the team, it is a paid position. So if you go out to the BJC website and you look for a regional clinical advisor, you will see that job pop up. So if you know someone who's looking to and has some experience with the coalition and doing planning, et cetera, here's an opportunity. And we want to get that filled. We had 3 applicants. Now we're just down to 2 applicants that have provided over the course of it's only been posted a couple weeks. But there are 2 applicants there. One of them is a Memorial employee, and the other is, I think, out of Children's, I believe so. I believe out of Children's. Next, pediatric care surge annex workshop. So one of our deliverables this year is going to be the development of a pediatric annex specifically to assist with surge planning for our region. And as you guys know, we don't have a ton of pediatric inpatient support on this side of the river, right? So a lot of things go over to St. Louis. So,
Bill?
Yes.
Hey, this is Kevin with St. Elizabeth.
Hey.
Hey, Just that you know, Phil, there are quite a few people on a different conference line trying to get into you.
Okay.
There was a conflict with 2 different conference line ID numbers. So
Yeah, I see that. I have
Okay.
an email pop up. Yeah. And that's
Yep.
that's why I try to send out that one right before the meeting so everybody can have. But I know some people probably had that. Yeah. If they're
The old
if
one?
they're- Yeah, if they're on, they probably had the old recurring one. Yeah, and
Right.
2 meetings
Hello?
ago, I said that one, those are all dead. Those are all those old Skype
Right.
numbers are dead. I won't even have access to them any longer. So
That's where we all were, Phil.
hanging out. It's okay. It's fine. I figured as much. That's why this is being recorded. So you'll be able
Everybody's
to.
coming across now. We should see about 15 of us joining, I think.
Yeah. I've let in maybe 12 of you guys in the past 20 seconds. So.
Okay.
But
Is that
but
still conference call too?
but again,
This is Sue from Staunton. I'm here.
hey Sue. We'll for those who are just joining us, we'll catch you guys up just a little bit at the very end. We'll try to grab those names and we'll get them all recorded so I can go back and document it. But whole meeting is recorded, so it'll go up on YouTube here shortly. But again, that pediatric care surge annex workshop, there are some outlining or there's some, I don't want to call them metrics, but there are some key things that they want to see in it. I've asked IDPH to provide a little more clarity into what is required in this pediatric surge annex. Let's say one of the line item requirements says have pediatric supplies, or no, age appropriate supplies. That's what you have to have in your pediatric surge annex or plan. Pediatric supplies. So what do you mean by pediatric supplies specifically? So trying to ask some of those questions, et cetera, to help flush it out. But we want to, we're targeting, early spring to have that done. More than likely, I don't think Terry's on because he's on vacation. But this is going to be one of the things that I'm going to pass over to Terry Everett, one of the co-chairs, to champion on this one, and working with Leanne as well to knock this out. Okay, so I think we got about a good 8 months to really dig in and put something to paper that we can actually use as a coalition. Again, regardless of the gray area that we do have. All right.
Phil, this is Kelly.
Hey.
Hey, is there a list out there that we're supposed to have for our pediatrics?
When you say a list,
Is there a list of supplies that we're supposed to have for our decon and stuff like that for our pediatrics?
Oh, is there a list of supplies for decon? No. However, if you took a look at, or if you had a copy of the EDAP preparation checklist, they do have some, I'll say, recommended things or recommended items for pediatrics. So while we don't have anything specifically laid out, and again, in our surge annex, maybe this is something we want to identify as good planning. That's why I think these workshops will help us build that plan to make sure that we're addressing those specific needs. So the answer that, do we have anything specific right now? No. The EDAP checklist does have one. And I don't know if Anna's on, but that checklist has been well circulated. I may include a copy of it when I send the link out to this when this goes up on YouTube, so you guys can listen back. Hopefully that answers your question. I know it's not a full answer, but hopefully that answers your question.
Yeah, that did.
Okay. Coalition
you
bylaws. I'm sorry.
You said Ann sent that out at one time?
I don't know if she sent it out, but it has made the circulation, especially if you're an EDAP facility. You've had a copy of that checklist and it goes over it. I know we've incorporated some of those in our hospital specific decon annex. But I don't think there's anything that's out there that says, hey, here's a list of things that you should have. But I think that's something well incorporating into, if we're going to do a pediatric surge plan, maybe that's something we want to identify.
Okay.
The coalition bylaws or governance documents, We are not a corporation, so we truly don't have bylaws, but what our governing document that we consider or call bylaws just needs to be updated as a review. We updated it earlier this year, I think in January or February of this year, maybe even March, but we made those updates, specifically the targeted changes for having a longer project cycle, so folks can submit project submissions, which is going on now. So that starts from 1 July every year to 15 December every year is when we'll cut it off. So if you've got projects on the horizon or things that you're thinking about, now's the time to do it. So we'll have to have that updated again by March 31st of next year. The KIMPACT full-scale exercise, it's we have to get it done no later than June 30th, but we're targeting late April, early May. In the budget, we did set aside some funds to work with one of our local contractors to get this done. And we've actually already had one or two just, they're not planning meetings, but, clarification meetings on exactly what we want to have happen in that exercise. And again, this will be a full-scale exercise. We've been talking about doing a KIMPACT exercise probably since I took over this position. And outside of the 2 tabletops that we've run and a workshop, we haven't made it to that level. This is going to help carry us over that hump, and this will be large. So again, great opportunity for regional participation. We will definitely be reaching out to each one of our EMS coordinators, our system coordinators throughout the region, to make sure that they're contacting and relaying this to our providers out there in the field, because we want a lot of EMS participation, but we really want an opportunity to kind of show off and find out what we're still missing with regard to an incident of this magnitude. And that's from our first responders to our first receivers through to potentially inpatient care, and how we're surging with that, with the kind of weird component of having a chemical involved that's deadly. So we will be conducting 6 no-notice EM resource and R4 call downs or drills over the course of the year. Those are already programmed, so they're programmed out to go out automatically. So some of them will happen in the middle of the night. Some of them will happen, hey, right now, if possible. Matter of fact, you've already had one happen this year. So for the hospitals that are on, and we're going to try to make sure we still conduct an additional 6 training courses, decon training courses over the course of the year. We have 4 on the horizon right now, before the end of the year, before December of this year. More and more people are taking advantage of this course, and I've only received positive feedback. So not to say that there isn't any negative feedback that's out there, but I've only received positive feedback. I don't know if Eric had an opportunity to join on the line. But
it was a great class, Phil.
Oh, there we go. Eric just hosted one, and it's a lot of work to get. It's a lot of work at the host hospital to make it happen, and a lot of work for us to get it out there. But I'll say, from our perspective of helping provide the and the assistance and training, we believe it's well worth the time invested. I'm hoping that I got positive feedback from Lee and the folks that were out there, and as you just heard Eric echo some of those things. Are there any things that you'd like to share, Eric, on this last experience, other than it was good? Any things that you'd like to share for the group here?
Yeah, I think they pretty much bring the show to you. You just have to reach out to Lee and his peeps and give them the information they're looking for. I mean, Lee's phenomenal instructor. The folks he brought with him from your decon team were excellent, from Remert.
Great.
And myself and Mark and Mr. Burke from Community Hospital of Staunton, they allowed us to pinch hit and do some instructing. So we got, our stuff checked off. So it was a win-win. Our people liked it. It was a nice muggy day, so it was good and sweaty. And no, it was great. It really was. I would highly recommend it.
Awesome. And I know we have one coming up at Fayette in a couple. It's on
September
the
11th.
upcoming stuff. Yep. So next month at Fayette, we have one here, one there. So lots of training, lots of training, lots of training. Your ED staff or those who are in the class will feel more confident in what they got to do next. Just got to follow it up with a couple drills. That's it. So any questions on the milestones and what deliverables that I have presented here? Okay, if there are no questions, what I will say is that when we send out, again, everything that we're pushing through as far as support that we need or anything like that is literally coming through the Member Planet website. So all the events, they're all listed there. So we're going to have some more workshops, and all of those events will be in Member Planet. So over the course of this week and next week, you will see everything that has to do with and more that have to do with these grant milestones out there in the visible. So really, really looking for places that may want to host one or two of these events, whether it's a workshop, tabletop, or anything like that. We're looking for folks that want to host that, and we're also really looking for people who want to fully participate. And I mean, it's great to participate in the meeting. It's great to and we appreciate everyone. I mean, the 24 calls that we have on right now that are, routine, they're day in, day out when the coalition needs them to be there. But we'd like some of the folks to go ahead and extend that arm and say, hey, you're going to do this. We'd like to run that for you or something like that. And it's not for running it for me to save me manpower or time or effort, but I feel as though that there's a lot gained out of having to put something together and then come up with a product. And if you're leading that, it's gonna only help you and your organization grow, and then it's gonna help the region grow. So we have no problem with running any and all these things, and we'll definitely be a part of those. But we just ask you that if you are participating, especially for those folks who are sub recipients of grants, because we do put some of that language in there, that you'll do like these pillar 4 things: participate in the HVA, participating planning when requested, that those are some of the expectations that when some of these things pop up, that somebody jumps on that grenade and says, yep, we got it, we can carry this across the finish line. So I'm looking for any and all assistance there. So upcoming events, we are having a Vericor Med, and for those of you who've seen, I think we talked about this maybe in June, but we purchased a full red, yellow, green triage mass casualty kit, rapid deployable response kit, however you want to call it. And we're going to be putting on some training demos with that kit and doing some, at least from the vendor, saying some mini drills. And I think that really is going out of grabbing it out the box, setting it up, what it takes to do that, and how it kind of can enhance or help your response to an MCI, to a mass casualty incident. And we're not promoting a specific brand or company, but that is the vendor who will be there doing that, because that's what we bought. And we think that some folks, when we do put this out, if you want to attend that, by all means, please attend, because I think you can probably take some ideas from it. Even if you don't buy anything from them, you can take some ideas of how you can better prepare yourself for MCI, trying to be a little more rapid response to it. Coalition surge tests, again, we're targeting, definitely probably won't hit it in August, but in September, we're looking to do the coalition surge test in September. Right now, Staunton's the only, hospital that's raised a hand and says, hey, we want to participate. We will have Memorial Hospital Belleville, Memorial Hospital East participating in this next one. It is, again, low threat, very low threat, and for everyone who's participated, we've not received a bad critique about it. I was very skeptical of it when it came out, but pleasantly surprised that we did learn some things, and I'm excited for that, and I'm excited for anybody who participates to learn some new stuff as well. We do have that emergency. Yes.
All right, this is Rick Wolf at Gateway.
Hey, Rick.
I interpreted Staunton only as that area only. That's the only hospital currently participating?
Correct. That's the only hospital that's currently participating. And you're right. So it's and again, it's for the entire coalition. It's the entire region because we really need to reach that.
What do you need? Gateway wants to participate. What do you need from me? An email or?
I'm going to send out the link, just the form link, and just fill it out and saying you want to play. It take you probably 2 minutes to fill it out. And
okay.
That's all I need. So if you want to play, that's how you're going to let me know you want to play. So that's good. We can have Staunton.
Yeah. We have
Gateway.
Leanne as an evaluator.
Oh, of course. Leanne's actually running it this year. So sure, she's running it this year.
That's September 30th?
Yeah, she's gonna be out of pocket for a little while, so the dates may have to change, but it'll be this fall. It won't be next spring or anything like that. So if we don't hit the September timeline, it's good because we have to get this done by June of next year, but I want to get it done by this fall. So we got time. Time's on our side in this one. But thanks, Rick. The emergency response to domestic biological incident that's coming up on the 23rd of October. Community healthcare planning and response to disasters course coming up in December. Those again are the dates for the decon training. I have Fayette kind of in parentheses there because that's the only one that's not taking place here at Memorial Hospital in Belleville. That's one of the road shows. And our full scale exercise in the spring of 2020. That's what we got to look forward to, team. So if I'm gonna at this point in time, I'm gonna open it up for questions, concerns, anything you wanted to get clarification on, and then once we're done that, for those of you that I did catch as far as attending, thank you. That way you can jump off after we have open floor. But those folks who came on a little bit later, I know I captured a few: Sue, Rick, and maybe one other. I'll make sure we'll get you guys so we know that we got you guys here for the conference call. So open floor, anybody.
Hey, Phil, is the grant up and running?
It is not. So great question. Okay. Normally I always have a grant status board. I feel like I have to have it. What I can say is that a week and a half ago, we received our comments back from we received the grant back with comments from IDPH. And we returned them within 24 hours. So they received it back the following day, maybe even by the end of that day, but definitely they received it back the following day. And we haven't heard anything since. So, so we're probably about 10, maybe 11 days since we sent it back. Greg, I don't know if you've heard anything or if there's any rumblings on, this is where it looks like it's at, but I haven't heard anything yet.
No, I haven't heard anything specifically for us. I know I did hear that I think 10 grants came in and 8 or 9 got sent back with comments. So if you've answered them and gotten it back in, it may be why it's taken a little bit longer, because apparently all the grants or most of the grants did require some additional information.
Yeah. So for us, so you guys kind of have a little bit of insight of what some of they want a little more fidelity in some areas. It's like you say this person, or you say, they looked at it really close. They said, you say you're sending 2 people to this event or this training event or the National Healthcare Preparedness Coalition Conference in the verbiage, but you have on here as it's 3 people. So you had to go, oh, okay, this is the 3rd person that's going. Other things were like you had to tie back what you were purchasing to a specific capability, and maybe there was an area in 1 or 2 spots where that wasn't listed, so put those back in. And outside of that, not much more feedback than that. So again, that's what enabled us to, and it was about 20 of those. It was like that, but it was really quick, easy fixes. So I'm hoping that the next one that we get back, if that's what was not holding everything up, but if that's what they had to look at, that should be something pretty simple. So hopefully we'll hear back something from Teresa or Katura maybe later this week or early next week. But I do think they have made a concerted effort to work, not to work faster, but to lean forward a little more. So this year we've done a lot more leaning forward as best as we could. I think the only thing that's going to be a big holdup next is going to be SIMP and having that ready, because they've got some things they promised us, but just they're not ready yet. And I didn't look today, but I did look last week. I did look on Friday. Things weren't ready, but maybe today it is ready. And we'll be able to upload information and things to it the way they want it, because that's really going to be their full repository this year. They're going to try to stick to that. But I said, you got to give us something so we can move forward with it. So any other questions, concerns?
Hey, Phil.
Yes.
Greg again. Hey, I was just going to put out there for situational awareness. Some of you may not remember, but the Crimson Contagion exercise is going on next week, the big federal state exercise in which local play is also happening. There is not much local play at all in our region, but there is quite a bit of local play from other regions around the state. So you may hear chatter on the radio, you may see things on the news about it, but just wanted to remind everybody that 4-day exercise Tuesday through Friday is going on next week.
Nice.
Phil, this is Tina at Fayette County Hospital.
Hey,
How are
Tina.
you?
Doing well. What's up?
I just have a question. We had the active shooter exercise at Scott Air Force Base on Thursday.
Oh, yeah.
And then on Friday, there was a call from Belleville Memorial that was really confusing on what was wanted, because at first, when my staff said there was a call, I took the call, and I thought that they was referring that we hadn't responded to the active shooter exercise, which we had, and then the confusion was that maybe we didn't hear an exercise go out over our STARCOM that morning, and then finally trying to figure it out. It was actually, they was wanting our number of red, yellow, and green. So it was very confusing that on Friday to figure out what it is they wanted and if we hadn't responded. So that was just my feedback from that.
No, I appreciate it. Yeah, we noticed that. I mean, we had some, I don't want to say we had a rookie at the helm, but somebody who hadn't done this in the moment of an exercise. It was weird. Same person, the same 2 days. Part of it was, I think the secretary that kind of manages that, she was like, "You want me to do this now?" And she didn't know she hadn't been trained to part of that. So it was a training gap, and we've identified it, and I appreciate the feedback. And hopefully the next time when we're in the middle of a drill, and this is why we do them, or exercise, that comes over a little clearer. So, because that one was not followed, that was not preceded. The second one wasn't preceded by any EM resource notification either. So they just did that kind of as a follow-up to what happened the day prior, trying to get a little bit better. So, but thank you for that feedback, Tina.
Hey, Phil. John
Yes.
Nowak.
Hey, John.
Good morning, everybody. Since that got mentioned, I would like to say that I've been able to participate with the drill that took place over here at Scott Elementary and the drill that's going on right now over in St. Louis in downtown. Them were both 2-day drills. The EM system alert, I know between some conversations between the drill last week and the drill that's taking place, well, it was yesterday and today, they're both 2-day drills. That EMS or that EM resource alert, they are trying to work. And I know Greg might know a little bit about this. Maybe they're trying to get it to where all of our, when we put out an alert on this side, as you would put out an alert, that it hits their trauma centers on the Missouri side. That's not happening right now.
Correct.
Because they would be a big part of that. And yesterday I found out the same thing. With the size drill that they were doing yesterday and today, which is the American Center, the old Rams Dome, they were talking 400 or 500 people injured from explosions and shootings. There was talk of people being transported over into the Illinois side. So again, that alert thing from EM Resources came up again. Would
Yeah.
the Illinois hospitals be even aware of it if they pushed it out across the resources?
Correct.
So I
You're
know
right.
that they're trying to work that out to where we put one out in region, our Hope Coalition, that it does reach at least the trauma centers, and vice versa. If it's done in Missouri, it'll reach out to the Hope Coalition over here on the Illinois side.
Yeah.
That was a big takeaway.
Yeah, I know that there is, there's still some manual stuff while we can see what's there. Yeah, it's not directly tied right now. So, but there is a, a manual, manual backup that we can do to send out an alert. But again, that will be through a separate system through Everbridge. To make sure we're ringing those phones at the same time, make sure that the SMOC and all the, like you said, all the trauma centers are getting that notification regardless. But that would be more of a manual, I'd say a manual method, but just basically having a good contact group loaded in our Everbridge. So I think that's something I'm writing that down now, to try to see if we can move forward with at least that. So at least we can follow up any EM resource notifications with at least the Everbridge alert that would at least ring those phones, get people in the know as quickly as possible. So, and as being a resource hospital, that's something that we should be, reaching out to the SMOC and everything when that does happen. So, so further down the chain, if there were, more things, that we've learned, when we did our hot wash here, just in the hospital, is that, first, second, third order effects. Yep, we got the notification. Now we told the hospitals here over the radio about the notification. Now who else do we need to contact? So even if we don't do it through EM resource, we should have a secondary method of getting and tertiary method of getting that information to those who would definitely receive a lot of those patients, with trauma. So thanks for that, John. Anyone else? Good conversation.
Hey, Phil, this is Sue from Staunton.
Hey, Sue.
Hey, when you send out a follow-up email for this meeting, can you put a link to the Member Planet and the YouTube?
Yep.
When you do the YouTube link. Thank you.
Okay, and make sure you guys are subscribed to it. I haven't looked in a couple of days, but make sure you subscribe to our YouTube channel. So yeah, I'll put that back in like at the one other in June, so you have access to these recordings. And again, this should be up by the end of the day today. All right. If we don't have anything else or nothing else for the order here, we're going to close it out. For those of you that I didn't catch, I know I got Rick, I know I got Sue, I know I got John, maybe one other, but and no, I think that's it that I noticed on the line, and I didn't catch you earlier.
Dan from Sparta.
That's what I was about to say. Just sound off. So we got Dan from Sparta. Who else?
Yep.
Mila from Eastside.
Phil, this is Scott from Memorial.
Gotcha. Gotcha.
Ruth Ann
Both.
Flowers from Green County.
Was that Pam Flowers, Green County, you said?
Ruth Ann.
Ruth Ann. Okay. Gotcha.
Thank you.
Leanne's here.
Oh, I got you, Leanne. Sorry.
Okay. Did you get Mila?
Calling in for Ryan Pirtle.
Got Mila, Eastside, and who for Ryan?
Ashley Spear at Alt Memorial.
Gotcha, Ashley. Thank you.
Thank you.
This is
Kevin,
Tiffany
Daddy.
from Holy Family Greenville.
Who from Greenville? I'm sorry.
Tiffany Wickman.
Hey, Tiffany. Are we going to see you next month? Face to face?
Yes.
Okay, great. Be a good time to meet you. We'll get you a formal introduction to the rest of the crew. So thank you. Who else was that sounded off when Tiffany sounded off?
It was Kevin.
Hey, Kev. Got you, brother. And I know we got Eric. Whom else? Who else?
Randall from Carlinville.
Hey, Randall. Gotcha.
Kelly from Jersey County.
Hey, gotcha, Kelly. Thank you. Anyone else? Anyone else?
Phil,
All
did
right.
you get me?
Yep. Is that Scott? Yep, I got you.
Yeah. Okay.
All righty. All right. If there are no more, we're going to close it out here. Thanks, everybody, for participating. Have a good week.